Good evening. I'm going to do a video tonight called A Rise in the PSA After Prostate Surgery. For those who are new and haven't subscribed to my YouTube channel, thank you very much for taking the time to watch. My name is Neil Davison, 53 years old and live in Safe Norfolk in the UK. Today is the 7th of November, which is nearly 7 months after my prostatectomy, which I had in the Norfolk and Norwich Hospital back in April. Again, for those who are new to my channel, just a quick brief history to those who don't know me. August 2023, I was in Latvia with my partner and had a random blood test for no reason, and it picked up that my PSA was slightly elevated. It was 5.6. I had another test, it was also 5.6. So I came back to the UK and had two more at the local surgery, the local GP here in Norfolk, and also all in around that mark, 5.6, 5.7. So the doctor wanted to see me for the check that he does, and it revealed nothing. He then put me on for a 2-week referral for MRI, and I had a PIRADS 2 excuse me, a PIRADS 2 which was looking hopeful. It did find a little image which we were still thinking maybe a cyst or something. So after that I had 16 biopsies 2 weeks later, and 5 did come back positive in December. 4 of them were what they call a Gleason 3+4, and 1 came back as a 4+3. So I later found out that 4+3 was one of the ones which was bulging on the edge, which they call a positive margin. If you have a positive margin, you are 30 to 40% more likely to get a reoccurrence. So I went to see the surgeon back in January, and we decided to have the prostate removed. My age being 52 at the time, recovery was going to be so much better for me because of my age. So I decided to go ahead with the operation. So we had the operation in April, April the 4th, and for a month later, all was well. Catheter in for 2 weeks, a few water infections, but nothing major. And after about a month, I was incontinence-wise no problem at all. Done my exercises, the pelvic floor, and all was going well, no problem at all. I put a video out in May after my 6-week blood test, which you have to have. If you've got no PSA, no prostate, you shouldn't have no PSA. And the result on the 15th of May come back less than 0.1 undetected, which is the best result you can get. And I thought that was done and dusted. I thought, yes, best result I can get. I'm cured, and I put a video out, and that video went viral, which was absolutely amazed me. Got 55,000 views, and most of them, 46% I think, were American, with Canadians, Australians, Indians, GB everywhere. And I thought, yeah, perfect, done and dusted, I'll be okay from now. Life's never that easy. I went to Latvia again in August and decided to have a private blood test at the place where we found it the year before, and I had a test and it come back 0.1. Now it looked like I'd lost the less than sign and the undetected. So 0.1 is still a very good result, but for me it's a rise. I had another test in October in Attleborough in Norfolk, and it was also 0.1. This test was a men's health check with cholesterol and blood pressure, and the nurse decided that she would do a PSA while I was there. That also come back 0.1. So it hadn't gone up, but it certainly hadn't gone down. And the way I look at it is that there are 3 numbers in the PSA after surgery. There's a undetected, which is virtually nothing. a 0.1 and a 0.2. And I'm led to believe once it hits a 0.2, then they will call that a reoccurrence. You probably have radiation, a PSMA scan, a PET scan to see where it is. There may be a bit of prostate where it's cut round and a piece of prostate has just fell off into the bed. And it just might be growing there. But if that doesn't work, then you have like the hormone therapy, the injections. So the October one was 0.1 as well, so it stayed level. So I've had a little rise, then it has stayed level. So I'm having another test next week, which is what the surgeon will report on. So I'm hoping that it stays at 0.1 or goes back to undetected. So we're just going to have to wait and see. Is it a worry? Yes and no. Yes and no. I'd have preferred a different test, what they call an ultra-sensitive test, which is to 2 decimal places. The test they do in Norwich is a 1 decimal place. Because the question I did ask is the same apparatus, the testing equipment the same in May, where I got undetected, to the same equipment they done in October. And yes, it was the same lab in Norwich. And for me, it's gone up. A little bit annoyed with the NHS to a certain extent. I do have the NHS app on my phone, and the report on there was no further action. But for me, it's gone up from an undetected to a 0.1. Now, when you go to 1 decimal place, what is 0.1? Is it rounded up from 0.06 and rounded down from a 0.14? So it could be anything in between that. I don't know. The ultra-sensitive test does 2 decimal places, which gives you, my first test might be 0.03, second test 0.09, third test 0.14, and maybe November's 0.17. So it gives you a graph of going up. But at the minute, August is 0.1, October's 0.1. So it's leveled off, and I've got some questions I need to ask the surgeon. How quick does he expect a reoccurrence to happen? Is it the first 3 to 6 months? I don't know. So I know a lot of people who will watch this will probably comment and say stop panicking, the 0.1 is good, but I pride myself on catching it very, very early in the first bout. People who have subscribed to me know my journey, where I've caught it in a very early stage, and I want to be pride myself to catch the second bout, if there is a second bout early. I'd rather catch it in December than May or June, when they'll probably want me to do a 6-month test from November. So I will request a test every month, and if they don't allow me, you have to be referred from the hospital. I will go elsewhere and get a private test, whether it be back to Latvia, which costs €6, and I get a couple of weekends away or something, or I'll find a private test in the UK, because it's my health. And the way I look at it is that if we can catch it in December, surely it's going to cost the NHS less money to zap it, and a piece that big compared to April and May, where it could be that big. So I don't know. I'm going to ask the question, and if they allow me, they allow me. If they don't, I'll look elsewhere. So every blood test I have at the minute, it just plots a different bit on the graph, and it just tells me what's going on. So that's where we are. I haven't done a lot of videos over the summer. I say recovery's fine. I feel absolutely perfect. So we're all good. I say there's not a lot to report from your 6-week test, which was in May, throughout the summer. So I've done everything I needed to do. A bit on holiday, done a bit of walking here and there, in Tenerife. So yeah, we're good. We're good, in a good place. Still positive, and I just like to keep on top of it and just keep pushing the NHS to get these tests done. So for those who are watching this video, I'm just going to ask for a favour of everybody. Now, anybody who's watching, I'm just going to ask whether you can stick a thumbs up or thumbs down if you don't like the video. What it does, it tells YouTube that people are watching, and it pushes it out to so many more people. We tried an experiment on this 55,000 view one back in May, where I got people again to put the thumbs up, and YouTube pushed it out to different people, and it went viral, which absolutely, amazed me. So, I need another 400 subscribers to reach the 1,000. That 55,000 view video I done back in May got me nearly 500 subscribers, and I've always said once I get to the 1,000 mark, then YouTube will put adverts on my channel, and I can earn a few pennies from these adverts, but I need to get to the 1,000. And I'm an honest guy, and I've always said that if I do get to the 1,000, any money that I do make, whether it be 1 pence, 100 pence, £10, £100, whatever, I will apply back into the local charity we have here in Norfolk, in Durham, and also the Big C charity, which is based in East Anglia, and a place where I go to have meetings about prostate. So any money that I do make, if I can get to 1,000 with your help, I will apply back into charities for cancer. So for me, I'm obviously going to say it's a win-win. It doesn't cost you anything to subscribe. It just means that you will know every time I upload a video. The word subscription or subscribe on YouTube, a lot of people think you've got to pay money. You don't. You just literally click the button, click the thumbs up. It helps me. It helps get to so many more different people. So, on Facebook, I run a Tenerife Friends group on Facebook, which is for people who go over to Tenerife. We're a lovely little group. We've nearly got 400 members, which is absolutely fantastic. I actually thought we were going to get 30 or 40, but we're up to 400. And I'm going to ask all the members there to support me by just watching this video. I'll put a little piece on the Friends group in a minute just to try and promote it. And I'm just going to ask you to put a thumbs up, or if you want to subscribe, please subscribe. So again, I'm not going to say I'm going to get 55,000 views on this video, but I just want to raise the awareness to any people out there who, if you subscribe to my channel, you can look back at the other videos and see my journey and see I like to get people to go and get a PSA test done. I had no symptoms at all. I just wanted a random blood test, and it cost me €20 in Latvia. So again, symptoms wise, I had nothing. So I'm early 50s, and there's a lot of people who are early 50s who will watch this. And so, if there is a chance of you having a test locally for £20, £25, I know that charities go around to Lions clubs, rugby clubs, Mason clubs. Please just go and try and get a test done. And again, from this 55,000 video, I had so many fantastic comments from around the world. I have many people, 5 or 10 people a week who privately message me from, say, Venezuela, Chile, New Zealand, from America, who just thank me for doing this channel and just trying to raise the awareness and to get the message out there. So again, I don't think I'll get to 1,000, but if I can get this video out there, and with some help, I've got some friends who are members on the Tenerife Friends group. Tim Dowd, who lives in Tenerife, who's a YouTuber, Daniel, the Crack Master, and Rick and Shelley and Kevin, Tenerife, Scotsman in Tenerife. I'm hoping that they will watch this and try and put on their social media platform to try and push it out there to as many people as I can. So thanks for watching. I will do an update in a couple of weeks' time after I have my November PSA test. Hopefully it will stay at 0.1, and then we go from there, and I'll report back, and we'll see what's what. So again, if you can stick a thumbs up on the video on YouTube, or again, if you want to subscribe, please subscribe. I really do appreciate it, and I say I appreciate any person who watches this and everything they've done for me. So thank you very much. I'll see you in a couple of months' time. Thank you.